Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to Health Matters. The focus of our discussion tonight is on preventative dentistry and other aspects that are practiced by dental practitioners. We have two guests in our studio tonight, Dr. Faisal Mansoor and Dr. Muhammad Adam. Welcome. And before I actually speak more about the guests, I would like to begin with the tarbiyah as is customary. A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Allah the Most Exalted says, quote, O my servants who have transgressed against themselves, do not despair of the mercy of Allah. Verily, Allah forgives all sins, for He is the forgiving, the merciful. The Messenger of Allah, peace be upon him, is reported to have said, quote, Indeed, before Allah created the creation, He decreed to Himself, my mercy prevails over my anger, unquote. This is from the Hadith, Bukhari and Muslim. Note, no matter how big the sin or sins that you have committed, no matter what your past has been like, if you come back to Him with one sincere tawbah, repentance, coming from the heart, He will indeed forgive you. Every pious person has a past and every sinner has a future. Allah created mercy in 100 parts and sent down to earth only one part. Because of this one part, there is mutual love amongst creation, so much so that an animal will be remaining 99, will then lift up its hoof from its young one, fearing that it might harm him. Allah has reserved the remaining 99 parts of this mercy to favor His believing servants on the day of judgment. Allah's love is much greater than a mother's love to her child. When you find yourself in the whirlpool of your sins, when you can't see yourself coming out of this mess, when all you see is darkness around you, remember, His doors are open for you. He loves you. If you draw to Him, He will talk to you. If you crawl to Him, He will walk to you. If you walk to Him, He will run to you. Don't despair. For as the sun fades, the stars begin to shine. When it appears that all you have left, remember Allah. Allah is always there and will never leave you alone. وآخر دعوانا الحمد لله رب العالمين. So we once again welcome our guests. Welcome Dr. Faisal Mansoor and Dr. Muhammad Adam. I would like to just give a brief introduction to the two guests. Dr. Faisal is a graduate of the Wits University. He is a dental practitioner, general dental practitioner with an MBA as well. So we've got a double whammy today. And his special interests are dental economics and innovative solutions. So we have a lot of, I think, exciting stuff lined up for us by Dr. Faisal Mansoor. Dr. Adam is a graduate of the University of Western Cape and has also a special interest in orthodontics, and he has a diploma in orthodontics. He has been in the field for over 20 years, am I correct? Yes, okay. So we're going to focus now on preventative dentistry, and perhaps you can speak more to that, Dr. Mansoor.
Shukran, Dr. Omar. So preventative dentistry is a branch of dentistry. There's 3 or 4 aspects to dentistry, one being preventative, one being interceptive, one being corrective, and one being surgical. Our focus for today is obviously on the preventative side, and what that basically means is what measures can we take, or when can we consult with our dental practitioner to prevent problems, dental problems from occurring? So in a nutshell, it's before the problem sets in, how do we identify and how do we take steps? What solutions do we adopt to prevent a dental problem from setting in?
Okay. Dr. Adam?
Yes, now prevention is a direction of dentistry that attends to the cause of the cause of teeth that are decaying, the cause of gums that are infected, the cause of incorrect tooth development, the cause of incorrect jaw development. So if you can fix and identify the problem at that early age, you can avoid the unfavorable sequelae that follow through, and hence save the child from the trauma of having to go through extensive treatment later on.
So I like what you're saying, because both of you are coming across with prevention is better than cure,
Yes.
but it also, when you mention the sequela, and I think if you can talk about that, what do you actually see as the outcome if there isn't proper preventative measures that have been implemented? What do you actually see?
Okay, firstly, if a child is at home and they don't brush their teeth, plaque will be visible on their teeth. So that's a sign. And if you do not take a step at that stage and you leave it long enough, it ends up with damage to the gum and teeth, and that becomes a symptom. So if the mum understands that she has to either get herself attended to, consulted early, treatment early, she can then save the child from the consequences of decayed teeth. So signs are there. That's the first sign for a poor oral hygiene. The other sign is where the child has bad breath. That's a cry for help. The mum has to then attend to it, either by improving the oral hygiene or go to a dentist and get consulted, and there she can get educated, motivated, and trained to manage the child better. And the following part is a child with any kind of bad habit. Bad habits have consequences. So any child who is either breathing with their mouth open, sucking their thumbs, using their facial muscle to swallow, will end up causing damage to the development of their teeth and to the direction of growth of their face. So there are consequences for that and expensive solutions to correct that.
Thank you for that. I want Dr. Mansoor to elaborate. We're talking about, I think Dr. Adam alluded to the dental hygiene, but brushing of teeth. So if you could speak and explain when is the appropriate age, or when is it critical for dental hygiene to kick in? At what age would you consider that?
Okay, so our topic is basically around prevention, and we're naturally assuming that we're talking about kids prevention. But prevention is all through the ages, whether you're a kid, whether you're a teenager, whether you're an adult, because at every...
So it applies to all.
Exactly. But since our discussion is limited to prevention in children, as soon as the first tooth erupts, prevention needs to kick in. So when your first tooth erupts, the mom has to obviously take either a face cloth or a cotton wool and just wipe the plaque off the teeth, if any. And as more teeth erupt, that's what we're going to do until the child is comfortable enough to have a toothbrush used in their mouth. So prevention starts definitely from the first tooth. We've seen many cases of parents not removing plaque off the teeth. Many parents putting the kids to sleep at night with juice in their bottles, and that leads to conditions called baby bottle decay, where most of the teeth are decayed. So a child of 1 year old, 2 year old need to be taken to theatre to obviously have all their teeth removed. So we're trying to prevent that from happening. So it starts with the very first tooth.
So you now sparking interest in you saying children drinking juice, but what about bottle-fed babies? Does that not collect plaque in the mouth if babies are drinking through the night?
That is a risk, but any drink that's obviously has a high sugar concentrate, high sugar substance is more of a risk. Ideally, you put your child to sleep at night and that's it. I mean, if the child is exclusively breastfed, there's no issues in that. But generally, it's called baby bottle decay or baby bottle caries because of the bottle being in the mouth constantly. We tend to see rampant caries or rampant decay in those children.
So what you are emphasizing is that mothers actually need to start the dental care from the time the baby is 5-6 months, or as soon as that first tooth has erupted and grown.
Dental care starts from the home. If you one of those parents, parents whose children don't develop baby bottle caries, and you think your child is a very nice dentition, then around the age of 2 or 3, that would be the appropriate age to have your first dental consultation. So generally in our practices, what we promote, when the mother or father comes in for the 6 monthly cleaning, we'll tell them, bring the child along. We won't do any work. We'll allow them to sit on your lap, let them play with the instruments, let them accustom themselves with the dental chair going up and down, so that it's not a new experience for them if they had to come and have something done in their mouth. And then 6 months later, we'll call them in and just maybe do a basic polishing, just to get them used to the dentist,
so
used to the team.
Relax them, you establish that rapport and pave the way for further intervention and preventative measures.
Exactly. So ideally, that's what we want to promote, is that you bring them in around the age of 2 or 3. But there are some of those kids that have problems, dental problems early on, and obviously we need to intervene in those children early on. And the most common, obviously, is rampant decay.
Dr. Adam, I like what you said. You mentioned the word plaque.
Yes.
Can you explain to me what you mean by plaque?
Okay. Plaque causes devastation in mouth. It's highly underrated by the majority of the population. It builds itself in the mouth from the waste tissue on the inside of the mouth, because the mouth is a very busy place. All the dead cells that slot off are accumulated, and they're sticky, and they attach themselves to the enamel of the teeth, and bacteria establish themselves in that plaque, and they give off acids and toxins. And these acids and toxins are the major culprits of causing inflammations of the gum, decalcification of teeth, and encouraging tooth decay.
So it's destructive.
Destructive. But even more is that these toxins get absorbed into the bloodstream, and the toxins are present right through the body, right into a placenta of a mother, right in the brain. So the toxin is not just limited or located in the mouth only. So brushing your teeth is not just for oral health, it's for general health.
I like what you're saying about general health, because you also mentioned earlier on about the offensive breath.
Yes.
Now, I'm not a medical practitioner, but we know that it's not always as a result of decay or tooth decay or plaque. There could be other contributing factors.
Yes, halitosis has systemic causes as well, besides plaque. So halitosis could be related to problems with digestion, some kind of medical conditions give off certain aromas and odors. Is it diabetic? So certain conditions have certain specific smells to them. And mainly the main cause of bad halitosis is sulfur, and there are specific treatments for that as well.
Okay.
Yeah, okay.
And are there any critical factors to prevention, Dr. Mansoor?
Definitely. I mean, the first thing we've got to look at is diet. If you're having a balanced diet, a diet that's not high in sugar content, that would be one of the preventative mechanisms, because the ability for bacteria to eat into your teeth because of the plaque is limited. So nutrition is important. Brushing your teeth twice a day, flossing at night. That's critical. If you don't physically remove the plaque off the teeth, you're creating an opportunity or a breeding ground for bacteria to feast on your teeth and cause decay. What would be the others?
I wanted to ask you, what about the fluoride? Giving children fluoride. I mean, I know in the days of yore they used to prescribe fluoride. Is that something that's still practiced?
Fluoride is something that's still practiced, but nowadays we have a fair amount of fluoride content in our toothpaste.
Okay.
Water is fluoridated, so we tend to limit fluoride as a daily intake. But when a child does come for a 6-month cleaning or a 6-month polishing, we do tend to do fluoride treatments at that point in time.
Okay. On that note, we'll take an ad break and continue with Health Matters. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. For the viewers that have just tuned in, the topic is preventative dentistry, and the guests in our studio tonight are Dr. Faisal Mansoor and Dr. Muhammad Adam. So just picking up on the preventative tools that parents need to be mindful of.
So Auntie Shada, to recap, it's the nutrition, it's a diet that's not rich in sugar, it's brushing your teeth twice a day and flossing, and obviously the most important is to visit your dentist twice a year.
Okay, so then you're raising a very important thing. When do parents actually take their children? The first visit, when should the first visit to the dentist be?
3 years is an average age that we feel is ideal. They're old enough, they're a little more mature, and hopefully they visited with their parents before that there. But some children, unfortunately, if they suffer with bottle decay, or their teeth have been damaged, they unfortunately will be treated before that.
So, Dr. Adam, I think earlier on in the first segment you spoke about habits as well.
Yes.
And thumb sucking.
Yes.
How does this affect the growth and formation of the teeth?
Thumb sucking below the ages of, say, 18 months or so is pretty normal, we call it, but beyond that it becomes a worry, because it starts to, the pressure of the thumb in the mouth starts to move the teeth forward, so they stick out of the mouth. Because what happens when you pressurize any tissue in the oral cavity, it moves. That's how we do braces. We move teeth by means of pressure. So the thumb is like an orthodontic appliance or growth modifying appliance, because when they put it in, firstly they retard the growth of the lower jaw and they encourage the growth of the upper jaw. So you find they end up with this small lower jaw and teeth sticking out on the top. So it's a destructive habit, and it must be discouraged as soon as it's identified. And parents, if they can't manage it, should not wait too long and should go and seek help from their dentist as soon as possible.
So the pacifiers, or commonly known as the dummy, when is a good time to wean children off? Because we find that children, 3 and 4 year old children are still latching onto that pacifier.
And we see a lot of it. I mean, if you go into any shopping center and into any restaurant, you'll definitely see 1 or 2 children, and they're 4 or 5 years old and they're still on the pacifiers. We think ideally around the age of 18 months we should start weaning them off the pacifiers, because that's the point where most of their primary dentition are in. There's just 1 or 2 more teeth that need to come in. So between 18 20 months, most of the primary teeth are in, and you want those teeth to function in normal occlusion. You want them to last the child or until his permanent teeth start coming out. So we need to obviously have a situation where those teeth are in its most natural form and it's functioning in its most natural form.
So what message would you give to the parents out there regarding the habits that children demonstrate and what to avoid?
Well, the pacifier strengthens up their cheek muscles, and they tend to constrict the growth of that upper jaw. So pacifiers have a limit. It's not something you can use forever. So parents have to get to a point where they have to terminate the use of it, and they've got to do it gradually. So over a week, a couple of days, they've got to wean the child over, prepare them psychologically, and there has to be a point where you have to stop. And then you have to bear the brunt of that, because the kid will not let go willingly. Yeah.
That's true, but then there's other mechanisms that one needs to implement to ensure that the child has some other supportive thing to lean on.
And we understand that it's obviously an appliance of convenience. I mean, if the child's always crying, always niggly, that's the easiest thing for a parent to turn to. But we've got to weigh and we've got to balance the needs and obviously the causes or effects of pacifiers. And one of the effects are, as Mohammed is saying, it retards the growth of the jaw, which then creates orthodontic problems going forward. So leaning on our topic of prevention, if we want to prevent the jaw from not growing in the manner that's meant to be growing, we've got to start weaning the pacifier out at a much early age, and around 18 months is what we feel is fair.
Yeah. The little tricks are to put some bitter elm on the pacifier, damage it, so it becomes uncomfortable.
No, it's not so pleasant any longer.
Yes, and of course, tell them it's dirty, the dog chewed it, or something that's disgusting, and they get put off from it. Or they give it away as a present to something. Yeah.
Now, I liked what Dr. Faisal said about, again, I think it was quite innovative, where reaching out to children before they actually need any preventative interventions with a dentist. So introducing them to this environment earlier on and allowing them to be at ease and relax. I think that's a brilliant approach, because that will not induce anxiety in children, because a lot of people grow up with those anxieties and have exaggerated fears of visiting the dentist.
Yes. So taking into account that it'll be a child's first visit, we've started a campaign called the First Visit Campaign. And what we've introduced is fillings that are color. So when a child comes in, if they need to have a cavity filled, we'll offer them, do you want a pink filling?
Choices,
do you want a blue filling? Do you want a yellow filling? Do you want a purple filling? So now they're like all fascinated, because it's like sweets in their mouth. So in most cases, the girls will go with pink, the boys will go with either blue or purple. And then they go to school the next day and show off to their friends. And now that's creating awareness amongst their friends to say, hey, we also want fillings like that. So it's allowing their friends to ask their parents to bring them to the dentist much sooner.
Oh, wow.
So we can obviously, from a preventative perspective, if there are fillings to be done, well, we offer them the color fillings. If there aren't fillings to be done, then at some point they need to have their permanent teeth fissure sealed. Now, fissure sealing is a preventative mechanism of just sealing the fissures of the teeth or the grooves of the teeth to prevent decay from setting in. So that's starting to happen. Kids are starting to take an interest. It's becoming cool for them to show off to their friends. And we're getting a lot of children coming in much earlier to ask for color fillings.
So I like your whole approach, because it's a positive connotation attached to dental care, and children are yes, and children are actually given the power of choice.
Exactly.
So they do not find themselves in a position where they are being prescribed to, but they are actually in a position of power where they feel they can decide what colors, how, and share this with others. So I think that is brilliant.
So we've also developed a mascot to go with the whole theme called Peter Penguin. So now there's a mascot that they identify with, there's a color filling that they have a choice on, and there's a game that we encourage parents to allow them to play before they visit the dentist, so they're familiar with the air that we're going to blow in their mouth, with the water that we're going to squirt into their mouth, with the hand pieces that we're going to use. So it's all preconditioning, so when they come to the practice, they're much more at ease, and they're asking relevant questions because they know what they're going to expect, they know what comes next.
The processes
exactly,
to follow.
The processes become fun for them, and what we're starting to see is that the experience becomes less anxious and more compliant. And when kids are compliant, it allows us to do wonderful work in their mouth, because it gives us the space and the room to obviously work and do what we need to do.
And it's something that they develop a sense of pride, because then they can flag this outside to all their friends.
We had a patient recently who took a photo, and she was a child that had her own Instagram account, and she posted her color filling on her Instagram account for her friends to see. So that's what's happening. It's becoming exciting for them, and so we're quite encouraged by that.
Dr. Adam, you mentioned something earlier on about posture.
Yes.
And I was wondering if you could elaborate on posture and the effect of the posture on teeth.
Okay, posture, skeletal posture is basically a straight back, shoulders back, yes, the jaw parallel to the floor.
Yes.
It allows a child to breathe properly and to get enough air into their lungs and be oxygenated. Now take the opposite of that, shoulders forward, back arched, the head down on the cell phone, on the computer, and it reduces the airway space. So that starts to decrease the oxygen level in the brain, affects alertness, and it brings into a problem learning abilities. So bad posture affects the breathing and the concentration of oxygen in the blood. Now, that is the posture of the spine, the head and neck. But the posture in relation to dentistry and teeth is the facial posture. Okay. If they have this no expression in their face, their muscles are not taut. They just relax, and we call it hypotonic muscles. In other words, soft muscles that are not functioning properly. What happens, the tongue on the inside is pushing the teeth out, and the lips and cheek are supposed to resist that push and keep the tongue in its correct arch form. And if there's no resistance, it tends to bully the teeth and push them out and creates malocclusion. If a child is watching TV with their mouth open and their lips are not sealed, then the tongue bullies the teeth and pushes them out the mouth. So that's where the posture comes into contributing to malocclusion. There's a balance between the tongue pushing outwards and the lips and cheeks pushing inwards, and that balanced zone is called a neutral zone, and the teeth like to live in that zone. But if there's a disturbance in the natural way the facial muscle is supposed to behave, then the tooth do not stay in the right place. We end up with malocclusion.
Somebody lay like me, I mean, what do I look out for in my grandchildren? You're talking about the facial muscles and that.
Oh, yes, if they're watching TV and their mouth is open, if they're doing their homework and their lips are not together, they keep on sleeping at night. You go into your room and have a look at them, and you find the mouth is open.
Okay.
If they children who are not do not use their facial muscles correctly.
So what would be a correct facial muscle?
Right, now when the child is eating their food and swallowing, they're not supposed to use their muscles of facial expression. They're supposed to just use their swallowing muscles. So if you can see visibly that they're swallowing because they use their lips and their cheek, that'll cause malocclusion, because it causes an imbalance between the relationship of the tongue on the inside and the lips on the outside. So any child who eats loudly on the table, who's sticking his tongue out every time he swallows, who's squashing up his lips every time he swallows, that child is got soft tissue dysfunction, and they end up with malocclusion. The type of dysfunction we call a reverse swallow is when they stick their lower lip under the upper teeth, and that pushes the lower teeth back.
Dr. Faisal, what are the effects of breathing, mouth breathing on the teeth?
Okay, so before we get to that, just to add to Mohammed, as a parent, this is a familiar sight for us. Right, so we've got our children whose shoulders are in.
That's right,
right?
yes.
And that's constricting the breathing. So because they can't get air in properly through their nose, they tend to breathe through their mouth.
Okay.
So as parents, most of us will notice, and we'll probably start noticing now after the segment, that you're going to see your child on the phone, shoulders are forward, heads forward, mouths open, because they're breathing through their mouth. And the problem with that is when they're breathing through their mouth, from a dental perspective, you're meant to breathe through your nose.
Yes.
If you breathe through your mouth, you tend to dry up the saliva.
Okay.
Saliva is extremely important because it's a washing mechanism. It has something called immunoglobulins that wash bacteria away. So if you're washing bacteria away, you tend to limit the risk of decay. The more bacteria there are in the mouth, the more the chance of decay setting in, because those bacteria are decay-causing bacteria. So you see children that are mouth breathers tend to have drier mouths, and they tend to have more decay in their mouths because the mouth is more subjected, or the environment is more subjective to decay. Apart from all the malocclusion issues that Mohammed mentioned, this is what we find from a dental perspective, is that we find drier mouths and more decay on those
Before
children.
we take an ad break, I just want you to then just inform the viewers, as parents, what do they need to do? Just what you've demonstrated was quite alarming and concerning.
Well, ideally, we should limit the amount of time our kids are on the cell phone or on the tablet, because naturally they're in those positions because the screens are quite small. But if they have, because nowadays most schools have homework on tablets, or expect your kids to do work assignments on their tablets. So we would ask you to encourage them to obviously have a good posture
and take stretch breaks as well.
Stretch breaks, and have the screen in front like this, not like this where you're limiting the breathing. And encourage nasal breathing. That's the most important, not mouth breathing.
Thank you for that. I think that's so fascinating and interesting. It's the first time that I've actually taken cognizance of something so important.
And these are simple things that parents can look out for from their own prevention. You don't have to go to a dentist to prevent. You can prevent at home, and that's the message we want to bring across today.
We'll now take an ad break and continue with the opportunities for question and answers in the last segment.
خدمة الأوام Our vision is to make Hajj and Umrah accessible and affordable to all Muslims in Southern Africa. Come in for a personal consultation at any of our offices in Johannesburg, Durban and Cape Town. Only South African Hajj operator awarded by the Muassasa for non-Arab African countries for good cooperation in Hajj 2013. Khidmatul Awam, your preferred Hajj and Umrah operator, striving to always make your travel experience affordable and memorable. Absolute Rigging and Transport specializes in abnormal transport, rigging and machine moving. Our fleet operates nationally and beyond the borders of South Africa, offering turnkey solutions. Contact us today to start extending your possibilities.
Trent, Tapentile or Monday, your home, our passion.
Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters. We're at the last segment of the show and the topic is on preventative dentistry, and our guests are Dr. Faisal Mansoor and Dr. Muhammad Adam. And I think the discussions have been so interesting. So viewers, please feel free to call in with your questions and comments. The lines are open for Q&A. Dr. Faisal, I think you left on such an interesting and important note. If we can continue that discussion, please.
So we were talking about mouth breathing. So one of the other consequences of mouth breathing is that when we breathe through our nose, obviously we've got hair follicles in our nose that filter dust and bacteria. In our throats and our mouths, we don't have those hair follicles to filter dust and bacteria. So what happens is those bacteria are now sitting at the back of our throat. And then you start seeing children having inflamed glands, adenoids, tonsils, and we have to have them removed. So recently, research has shown a correlation between mouth breathing and inflamed tonsils and adenoids. So from a preventative perspective, if we encourage our children to breathe through their nose, then there's a chance that we can prevent those inflamed tonsils and adenoids, and we may not need to have them removed at some point. So as we mentioned, prevention starts at home. If our parents can, and I'm sure after today's segment or after today's program, they'll be more aware, if they can guide their children on nose breathing, on brushing twice a day, and visiting the dentist twice a year, I think we'll do a lot from a prevention perspective for your child.
Okay.
Can I just elaborate more on mouth breathing? Mouth breathing, especially a chronic mouth breather, is the worst disaster for the growth of the face. As soon as the tongue leaves its place, the tongue belongs in the palate. The tongue directs the growth of the face in a forward and downward direction, ending up allowing genetics to express itself. But if the tongue leaves the palate, the whole palate collapses. It becomes narrow, the teeth grow longer, the face elongates, it goes down. Malformation. Right down from, instead of going in the right direction, it then comes and chokes the patient in creating a reduction in his airway. So mouth breathing is a cry for help. It should never be ignored. And it's treated by a team of doctors, not just a dentist. So you've got to make sure your GP is on it, your ENT is on it, an allergy specialist is on it. So everyone's got to make sure they do everything they can in their power to get this child to be able to breathe through his nose. Yes, so dentists can't just close your mouth and breathe through your nose. It's easy to say. There's other problems related to that. There could be allergies, inflammation, deviated septum, so adenoids, tonsils.
In-depth investigation,
yes,
medical investigation.
It's a team effort for those children, but they need urgent attention.
Okay, thank you for that. Dr. Mansoor, there was mention of malocclusion. Can you elaborate on that? Because I didn't understand malocclusion, and I'm sure our viewers would like some clarity on that.
Okay,
please.
so malocclusion is basically, occlusion is basically the way the top jaw and the bottom jaw fit together. So this is occlusion. This is called a class 1 occlusion. Malocclusion is every scenario besides this. So sometimes, as Mohammed is saying, the lower jaw doesn't grow as fast as the upper jaw.
So this is actually what is normal, what you are showing us.
Yeah, so this is what we would call a class 1 occlusion, right? Sometimes the lower jaw is recessed and the upper jaw is forward. That would call a class 2 occlusion, and vice versa. You got the upper jaw back and the lower jaw forward, like, not as exaggerated, but like this, right?
And it's speaking to what Dr. Adams said about the tongue leaving its space, moving away from the palate.
Yes, so the teeth move out of the way. So a simple definition, it's a bad bite. This is a perfect bite where teeth relate. But malocclusion means the bite is not matching. And all the jaws are not relating to each other. So,
Okay, so we've got a caller online. Assalamu alaikum wa rahmatullahi wa barakatuh.
Assalamualaikum.
Walaikum salam. Brother, please present your question or comment.
What are the doctor about the effects of mercury pudding? And other questions about the bacteria and unattended teeth problems. Can they cause heart problems?
Did you get that?
Okay. So the debate on mercury fillings rages on, right? The World Dental Federation has a Vision 2020 to rid the world of amalgam fillings by 2020. So basically what they're trying to do is, from after 2020, no dentist in the world should be placing silver amalgam fillings. But there is a generation of my parents and in my
Can I
generation.
just ask the viewer, can you switch off your television, please? It's affecting the sound. Okay, continue, Dr. Mansoor.
So my parents' generation, my grandparents' generation, and my generation have silver fillings. I've got silver fillings in my mouth, right? So nowadays, we won't opt to put a silver filling in the mouth as a first port of call, right? But if you've got a silver filling in the mouth and there's nothing wrong with it, if you take an X-ray, there's no decay, we encourage you not to replace it. But there are certain schools of thought that encourage you to replace it.
Okay.
So essentially, the schools of thought are mixed. The research is mixed. The amount of mercury that's found in filling is negligible. So it's basically left to the patient for them to decide. Most patients replace their silver fillings nowadays for aesthetic reasons, not for any other reason.
Okay.
But we won't encourage the patient to unnecessarily remove a silver filling and place a white filling if they're happy with that filling in their mouth, because it can cause other complications.
We had another question about affecting the heart.
And the other question was affecting the heart. So there's also a school of thought that believes that the mouth is the window to the rest of the body. In fact, there are some dental schools throughout the world that are calling themselves the School of Dental Medicine, because they look at dentistry as part of as dental medicine. And there are some countries that call dentists oral physicians. Because of interaction of the mouth to the rest of the body.
I like that, oral physicians.
It sounds glamorous.
Isolated profession, yes.
So there are certain conditions that can affect the heart. If you had infective endocarditis or if you had rheumatic fever as a child, there's a chance of you developing something called infective endocarditis later on in life. Or if you've had that, or if you have any surgery on your heart, you take prophylaxis before any dental treatment just to prevent bacteria causing any problems. It's not that if you don't, you're going to get you're going to have a problem, but just a prophylactic measure that you would take if you had rheumatic fever as a child and infective endocarditis later on as an adult.
Thank you. Yes, please do.
Just like penicillin is good for someone and can kill someone with an allergic reaction, so is mercury silver fillings that behave well on some people and affect other people very negatively.
So it's not a one-size-fits-all, hey?
No, but because of mercury, you want to get rid of it. But there are some people that are highly sensitive to it. Okay. And if they are confused, then they need to investigate further.
So I want to, we haven't got any other callers. I have a burning question regarding braces. Can one actually prevent or delay that?
Oh, yes. If you...
Because I just want to say it's so common. Every child one looks at is called in for braces. I mean,
this is quite common nowadays.
Yeah.
So I think when we started off, we mentioned that we defined preventative dentistry. We spoke about interceptive and corrective. If you're considering braces, it means your malocclusion has set in and you're looking at corrective.
So that what you demonstrated
Exactly,
to us is
exactly.
already malformation and needs to push the teeth back.
So what I showed you was the jaw, the position of the jaw with straight teeth. But now think of the position of the jaw with crooked teeth, with teeth not so properly aligned.
Any of these here?
No, this is now sort of rampant decay.
Okay.
Right. So if we're considering braces, it means the malocclusion has set in, and now we want to mechanically sort things out. If we look at other options from a preventative perspective, then braces, there are options that we don't need braces for, that Mohammed would elaborate on.
Can you tell us more about those options?
If the cause of the crooked teeth is muscle malfunction or muscles behaving badly, like we mentioned, if they breathe the mouth open, the wrong posture, if they're swallowing incorrectly, if they're doing any of those habits, there are appliances in the market that can be used in the mouth that will help the patient and teach the child to breathe through their nose, keep their tongue on the palate, keep their lips together, and swallow without using their muscles or facial expression. And this appliance will train the face, because remember, bad muscle habits become ingrained in patients, and it's part of their memory, their subconscious. So you cannot just tell a child, stop sticking your tongue out. You need to train him. So you need an appliance and you need a training program. And there are such appliances in the market that can do that.
Tell us more about those appliances. What is it that's available, and what is it that parents can use?
Yeah.
So Antisha, this is a model of a child, right? So this is an appliance that Mohammed spoke about. This is called a myofunctional appliance. So what it has is, it has something called a tongue tag on the top.
Okay.
So what that does is, when the child sleeps, it pushes the tongue to the tongue tag. So that allows the mandible to grow forward. The tongue needs to rest in the palate. So we would then deliver an appliance to the child, and they would then obviously sleep with it at night. All right. By sleeping with it at night, we prevent, with activities that they need to do, we help them prevent mouth breathing, we help them prevent reverse swallowing, we help them place their tongue in the soft spot, in the sweet spot, which is the palate, and we basically train the jaw to grow forward in line with the top jaw, so that we can get a nice class 1 occlusion.
Yes. The appliance is designed with the relationship, the top jaw exactly we call it a skeletal class 1 relationship, the perfect profile of a patient.
Okay,
so when the patient, it's soft, it's flexible, just like the soft wires the orthodontists use. So it molds, so it comes,
soft,
yes, so it comes
soft.
and find a mouth that's, say, V-shaped,
Yes.
and this appliance is U-shaped. When you squeeze it into a V-shaped mouth, over time, it encourages the growth into the U shape. So it directs growth.
So it doesn't feel like you're being gagged or anything, hey? Because
No.
it's so soft and...
Yes, so there's a very soft first appliance that's used for about 4 to 6 months, and then you follow through with the second appliance, which is much firmer, and then the final appliance, which aligns your teeth. So when you're young, between the ages of 6 to 10,
I was going to
it's
ask
the
you at what
perfect
age,
time because
yes.
you're growing. And
Okay.
the beautiful part about this appliance is that you use it at home only. So 2 hours, 1 to 2 hours of exercise,
Yes.
and you break that up in little sessions, and then you sleep overnight with it. That's all it takes.
So
And then
if teeth are already crooked, but these are little children,
Yes, yes.
can you still provide this intervention?
Little children, growing children, it's perfect. It guides the teeth. We call this the channels in which the teeth are supposed to be, so it guides them into there. And if the jaw is narrow, it stretches out, it's got a memory. So no matter what you do to this, it always remembers its shape. So it directs growth. So it finds a narrow jaw, it squeezes in, and over time, it gets the jaw into the perfect shape.
But it's also a cheaper option, isn't it?
Yes, in lots of children at a young age, it can help them not have to have fixed braces. But
So we're not
these-
saying,
yes.
we're not taking away orthodontics.
No, you can't.
But this could be the first step
Yes.
in preventative
Orthodontics,
measures.
yes.
Orthodontics.
It's for mild to moderate cases. And
Okay.
it's got its problems or limitations, just like orthodontics.
Indeed.
It's compliance. So you need the right parent, and the right child, it works for that child. If the child can't manage, it's not going to work. The appliance only works if you're compliant. You've got to use it. And we only ask for 2 hours a day overnight while sleeping.
Okay.
So in dentistry, we have a saying that dentistry is not expensive, neglect is. Right?
I like that.
So if you're thinking about dentistry from a preventative perspective, it's not expensive. If you look at a child that's in the mixed dentition, now mixed dentition is that phase of a child's life when they have some baby teeth and some permanent teeth. So baby teeth are falling out and permanent teeth are erupting. We call it the ugly duckling syndrome because really there are some missing teeth, there are some teeth longer than the other.
Gaps in the mouth.
All those gaps in the mouth. And that generally starts from around the age of 6 years old till about the age of 11, 12. That's when these appliances are the most useful because that's when malocclusions are setting in. So if they've got pre-established habits of bad posture, soft diets, sugar-based diets, mouth breathing, then these appliances can obviously help them break those habits and guide those teeth into a natural skeletal one occlusion whilst they're achieving growth. Because in that mixed dentition phase, the jaw is expanding, so they're achieving growth. So whilst growth is taking place, if they've got the appliance in the mouth, we can harmonize the growth, the biological growth, in line with what the genetics intended.
Okay.
And the results are more stable.
Okay.
If you can allow growth to the appliance to perfect growth.
So what you're saying is that you start with a conservative approach, but you pick it up when the child is quite young.
It's young. So you don't have to wait till the age of 12 and 14 anymore to have braces.
Okay.
If you're complicated and severe, yes, the specialist decide when he's got to start you. But if it's mild to moderate, you don't have to wait that long anymore.
Okay, Dr. Mohammed, on that note, we're going to take an ad break and we're coming to the final segment of our session today. Assalamu alaikum wa rahmatullahi wa barakatuh. We've come to the fourth segment and the last segment of the session, and our guests in studio are Dr. Faisal Mansoor and Dr. Mohammed Adam, and we've been talking about preventative dentistry, and I have to add that I have learned a lot myself this evening, but we'll continue with the experts here.
So Auntie Shaida, what we'd like the viewers to take home is that in their child's development, there's 2 ages that they must be cognizant of, the age of 3 and the age of 7. At the age of 3, we encourage them to have their first dental checkup. If they don't have their first dental checkup at the age of 3, and there's issues that's coming beforehand, it will be obvious that they need to bring the child before. But if there's no complaint and if they feel that their child's dentally sound, then the age of 3 is generally a nice time for them to have their first visit. And then we can grow with the child, we can develop a relationship, we can grow with the child, we can identify habits, we can identify early decay, we can identify if there's any plaque, we can identify if the child's brushing properly or not. And the age of 7, because malocclusions start developing around the age of 7. So the American Dental Association now recommends that a child needs to have an orthodontic assessment at the age of 7 to screen for malocclusions.
Okay.
If we pick up a developing malocclusion and we pick up that the developing malocclusion is habit related or myofunctional related, then a general dentist can intervene without a doubt. That ugly duckling stage that we spoke about, that mixed dentition stage that we spoke about, is not just a stage of the child's self-esteem and confidence. It's not just a stage of malocclusion setting in. It's also a stage of oral hygiene, because now you've got permanent teeth setting in, and those teeth are meant to last you the rest of your life. Now, we've picked up in practice that generally the first tooth that needs a root canal treatment is your first molar. And the reason for that is the first molar is the first permanent tooth, back tooth to erupt around the age of 6. So that tooth's in the mouth the longest, it's subjected to the most wear and tear, and generally it's the tooth that needs the root canal the soonest. Now, if we're building a relationship with your child and we're advising them every step of the way, we can prevent that root canal at the age of 15 or 16.
We've got a call on the line. Assalamu alaikum wa rahmatullahi wa barakatuh.
I want to find out, I'm interested in the where will come things that the doctor should.
If you've got your television off, please switch off the television.
Yes, television is on. So I like to find out the cost implication related to one that for your child.
Can you repeat the question, please? I don't think the guests have understood.
Okay, the insurance screen now, the thing that
Yes, yes.
things that we have there.
Yes.
If you're not going to use the mental stuff in basis. I just want to know how to get that and what are the cost implications if you go to the dentist when you want that for the child.
Yes.
Okay.
The appliances are used by dentists that have attended a course and received a certificate on training of the use of these appliances. And if you go onto the website www.mybrace.com, then there's a link you can request for a dentist, and they will then give that request to Faisal. And
Okay.
Faisal will then contact the patient and tell them which is the closest dentist in the area where they live that has attended our training and is skilled enough to use the appliance.
But I think he's asked more than it. Didn't he say at what age and the cost implications?
Okay.
So generally, we would like to see the child at the age of 7, because that child is in the mixed dentition phase, and this is when these appliances work the best. The cost implication is obviously based on each individual dentist and their cost structure, but it's cost effective. It's not going to break the bank. Obviously, it's a preventative tool. It's an early treatment option, so it's really cost effective.
Can you perhaps give a cost range so that people get a benchmark of what they need to
It's difficult to give a cost range. It's difficult to give a cost range because you need to diagnose the case, right? But I would think anything from 18,000 onwards over a 24-month period.
Okay. Yeah, because to grow a patient correctly, it takes a while. All our treatments take between 12 to 24 months, so that cost will involve a treatment over that period of time.
So we're looking at, if you're saying 24 months and 18,000, so we're looking just under
Just a few hundred rand a
1,000
month,
rand per month.
Yes.
Over 2 years.
Yes. Some medical aids do pay for it.
Oh, some medical aids do cover
and
it.
some medical aids have an issue regarding the laboratory cost of it.
Okay. I'm sure that's answered the question. If we can continue.
Okay. Regarding advice to parents with their children, there's certain things they should always identify. Posture we mentioned about the straight back, shoulders back, chin up. That is a pre-requirement when you grow your children at home. They got to.
So parents need to look out for their child's posture at all times.
Yes. When the child eats on the supper table, they got to be eating with their mouth closed, and they got to be swallowing without using chewing with their mouth closed, and they got to be swallowing without using their muscles or facial expression. In fact, there should be no movement on your face when you swallow. When the children are watching TV, playing around the house, they should breathe through their nose. If they just watch for those things, they can then prevent any kind of this.
Dr. Adam and Dr. Mansoor, I don't seem to get, and maybe it's something that we haven't looked at, but diet as a preventative measure.
Yes.
What role does diet actually play?
Diet is very critical in firstly for us, when we talk of muscle function, children, unfortunately, in most homes, sometimes are always kept on a soft diet. And the growth of the face is related to muscle. Form follows function. You need them to be on a hard diet. If you don't have hard foods for them to chew on.
Be more specific when you make reference to hard food.
Hard food, they got to either have vegetables that are undercooked, so crispy vegetables, chew on raw carrots, bread that's not too soft, so they got to add crispy things. They got to chew on fruit. They got to they should not have food that's overcooked. So we're talking of anything that stimulates muscle action.
So when I was growing up, it was always the proverb of an apple a day that keeps the doctor away.
Yes,
Does that
now,
still apply?
A carrot a day keeps the orthodontist away.
Oh, okay, that's nice.
Yes, because it stimulates chewing. And we said form follows function. The more you chew, the more your face grows and the more your teeth find space to fit in.
Okay.
But if you have a soft diet, your face underdevelops. When the teeth come along, you find they don't have space to fit in. So anything that's going to allow you to chew is a good diet.
So when I was making reference to diet, I also thought about when they talk about bone density and the importance of calcium.
Yes.
So where do we get the extract of calcium? What foods would contribute, or what would we say to the viewers out there?
I think milk would be the most obvious form of calcium, because your teeth are housed in bone. So if you look at this model, with not very nice teeth, but this is meant to simulate bone. So if the bones surrounding the teeth are weak, your teeth are going to become loose and they're going to fall out. So apart from keeping the teeth nice and strong, we need to keep the surrounding structures nice and strong, and milk is a nice source of
So to continue giving milk to children,
Definitely.
even after they've gone through that bottle feeding, breastfeeding, all of that, that milk needs to be still a staple part of their diet.
Definitely.
Okay, so we've come to the end of the show. One message, and then we're closing.
Okay. So basically, dentistry is a profession of cause and effect. If you've got the right stimulus, you can prevent a lot of expensive, unnecessary dental work going forward. We'd like to treat patients in every life stage, because in every life stage we've identified risk factors. So if you're comfortable with a dentist and you're building a relationship with them, make sure that you're being assessed for your life stage risks. Because if we're managing life stage risk, we can manage dental risk.
Thank you. Short and brief.
Okay. I'd love for parents to be educated with the skill, the knowledge, and the ability to identify soft tissue dysfunction and to be able to understand the devastating and detrimental effects of soft tissue dysfunction, and finally to then seek treatment and help as early as possible while the child is growing.
Shukran dalilan. We've come to the end of the show, and I would like to take the opportunity to extend a special thank you to Dr. Faisal Mansoor and to Dr. Muhammad Adam. I'm sure the viewers will agree that there was a lot of new information, and it was absolutely informative, enlightening, and enriching, and of course educating to us as parents and general public. But before we end, I'd like to end with a verse from the Quran. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم والأسر إن الإنسان لفي خسر إلا الذين آمنوا وعملوا الصالحات وتواصوا بالحق وتواصوا بالصبر. صدق الله العظيم. Until next time on Health Matters.